Hi, I'm Dr. Pablo Perez, certified surgeon by the Mexican Board of Orthopedic Surgeons, and today we are going to talk about something that we might not notice in our daily lives, but it's a big public health problem. This is falls, especially falls in the elderly people. All of us are surrounded by people over 65 years that really matter to us. In this podcast, we are going to talk about how to improve the risk of a fall in this age and take care of our golden ager. Did you know that falls are the most important factor for morbidity and mortality in the elderly? 25 patients with a hip fracture die in the next 6 months after the fracture. That sounds terrific, isn't it? But those are the numbers. Also, it's important to know that 25% of the patients with a hip fracture become functionally dependent. Falls, being the second leading cause of accidental or unintentional injury deaths worldwide, make this an important issue. Every year, 646,000 individuals die from falls globally. 80% of them are in low and middle income countries. The people who suffer the greatest numbers of fatal falls are adults over 65 years and over. With this information, we can start a conversation about how to take care of the elderly by preventing falls. There are many ways to prevent falls, but the first thing to do is to identify the causes and later make interventions. In this podcast series, we are going to address the different ways we can improve these problems and with this help our elderly to avoid the disastrous effects of a fall. One of the most important factors for a fall is to be a person taking more than 5 medications at a time. Imagine someone who is prescribed with medication for high blood pressure, diabetes. Also, this patient have a heart condition that need diuretics, making this adult going to the bathroom 3 to 5 times at night, and this same adult take sleep pills. Could you imagine this scenario? Or even more, could you imagine being this old adult under the effect of the sleeping pills and having the necessity to visit the bathroom 4 times in the night, with all the house with little or no light? Of course that the risk of fall is high. This is why it is important to identify the people with these conditions and make an intervention to avoid falls. What could be done to prevent falls? Well, listening on this podcast series, you will discover how to start preventing falls. Of course that accidents can happen at any time, but there is also true that there can be a decrease of the probability by increasing the costs of making little changes in the environment and behaviors. So again, I welcome you to this podcast series of preventing falls. I invite you to listen to our weekly conversation with specialists who are going to share their expertise on how to prevent the fall with little environmental or behavioral changes. All this information and podcasts will be available through your YouTube channel and webpage. Please be aware of the new releases by subscribing on the link.